Welcome to this educational video about collapsing glomerulopathy, a serious kidney disease that can lead to significant health problems. In this video, we'll explore what it is, what causes it, how it affects the kidneys, and what can be done about it. Collapsing glomerulopathy, or CG, has several potential causes. One of the most common is viral infection, particularly HE. Genetic factors can also play a role, with certain gene mutations predisposing individuals to the disease. In some cases, it can be triggered by drug use, particularly intravenous drugs like heroin. Finally, CG can arise as a secondary condition related to other underlying diseases or medical conditions, such as focal segmental glomerulosclerosis. To understand the pathophysiology, we first need to know the basics of kidney function. The kidneys filter waste and excess fluid from the blood through tiny structures called glomeruli. In collapsing glomerulopathy, the glomeruli essentially collapse. This collapse involves podocyte injury. Podocytes are specialized cells that help filter blood in the glomeruli. Damage to these podocytes leads to their swelling and proliferation, causing the glomerulus to collapse and scar. This collapse leads to a drastic reduction in the kidney's ability to filter waste, eventually resulting in kidney failure. The exact prevalence of collapsing glomerulopathy is difficult to determine, as it is often diagnosed under the broader category of focal segmental glomerulosclerosis. However, it is known to disproportionately affect certain populations. Individuals with HIV infection are at higher risk, as are people of African descent. Intravenous drug users also have an increased susceptibility. Incidence rates vary depending on these risk factors and geographical location. The signs and symptoms of collapsing glomerulopathy can vary, but some of the most common include proteinuria, which is protein in the urine, edema or swelling particularly in the legs, ankles, and around the eyes, high blood pressure or hypertension, and fatigue. As the disease progresses and kidney function declines, patients may also experience nausea, loss of appetite, and shortness of breath. These symptoms often develop rapidly, distinguishing collapsing glomerulopathy from other kidney diseases. Diagnosing collapsing glomerulopathy typically involves a combination of clinical evaluation and laboratory testing. A urine test to check for proteinuria is a key initial step. Blood tests will be performed to assess kidney function, measuring creatinine and blood urea nitrogens at BUN levels. However, the definitive diagnosis requires a kidney biopsy. A kidney biopsy involves taking a small sample of kidney tissue, which is then examined under a microscope. The characteristic collapsing glomeruli are then clearly visible to confirm the diagnosis. While collapsing glomerulopathy isn't strictly divided into distinct types, it's often classified based on its underlying cause. We differentiate between HIV-associated collapsing glomerulopathy, drug-induced collapsing glomerulopathy, and collapsing glomerulopathy related to genetic mutations. Recognizing the underlying cause is important because it can influence treatment strategies. Treatment for collapsing glomerulopathy focuses on addressing the underlying cause and reducing kidney damage. For HIV-associated cases, antiretroviral therapy is crucial to control the viral infection. Immunosuppressive medications such as corticosteroids and cyclosporine are frequently used to suppress the immune system and reduce inflammation. Managing blood pressure with medications like ACE inhibitors or ARBs is also essential. In advanced cases with kidney failure, dialysis or kidney transplantation may be necessary. Preventing collapsing glomerulopathy largely depends on addressing the known risk factors. Avoiding intravenous drug use is critical. For individuals with HIV, consistent adherence to antiretroviral therapy is paramount. Genetic screening may be considered for individuals with a family history of kidney disease. Early detection and management of underlying medical conditions that can contribute to CG are also important preventive measures. The prognosis for collapsing glomerulopathy can be variable, but it's generally considered a serious condition. Without treatment, it can rapidly progress to kidney failure. Early diagnosis and prompt treatment can improve outcomes, but many patients still experience chronic kidney disease. Recent research focuses on developing more targeted therapies to protect podocytes and prevent glomerular collapse. Scientists are also exploring new biomarkers to improve early diagnosis and predict disease progression. As research continues, we hope to see improved treatment options and better outcomes for patients with collapsing glomerulopathy.